You are welcome to CornerStones Klinic channel, an interactive channel dedicated to increasing young people's access to reproductive health information and services. A gynecologist with a passion for young people's reproductive health and well-being is piloting this channel. Today, I will be discussing the topic of sexually transmitted infections. Let us consider Isabella. She is an 18-year-old girl who is worried about the risks of acquiring sexually transmitted infections. She wants to know the best method of prevention. The best method to prevent sexually transmitted infections is through abstinence. Abstinence ensures 100% protection against sexually transmitted infections. Sexually transmitted infections are infections that are acquired through sexual activities. It can be through vaginal, oral, or anal sex. The highest prevalence is seen among young people worldwide. They include gonorrhea, chlamydia, trichomonas, syphilis, HIV, hepatitis B, hepatitis C, human papillomavirus infection, and so on. All sexually transmitted infections are treatable, but some are not curable. A condom can prevent sexually transmitted infections, but it is not 100% protective. Girls are more susceptible to sexually transmitted infections for the following reasons. Location of organs. Male organs are easily visible and female organs are harder to see, so STIs in men are easier to notice. The majority of STIs do not show symptoms in girls. Changes that occur in the female genitalia during adolescence make them more susceptible to sexually transmitted infections. Girls do have receptive sexual intercourse. The semen stays longer in their body and is exposed to the organism for a longer period. Shyness and issues of sexuality. Many girls have little power to protect themselves in sexual situations. Girls find it difficult to negotiate for safe sex. They also feel reluctant to access care after noticing symptoms of sexually transmitted infections. Symptoms of sexually transmitted infections: vaginal/urethral/anal discharge, painful micturition, itchy genital or anus, blisters or sores around the genitals or anus, warts around the genitals or anus, lower abdominal pain. I also want to talk briefly about complications of sexually transmitted infections. If left untreated, sexually transmitted infections have grave consequences. These include pelvic inflammatory disease, which manifests with lower abdominal pain and vaginal discharge; infertility, which is the inability to conceive due to blockage to the fallopian tubes and sperm duct; ectopic pregnancy, which is pregnancy outside the womb; chronic pelvic pain. This is continuous or intermittent abdominal pain below the umbilicus, which has lasted for at least 6 months; urethral stricture leading to straining during micturition in males; cancers. Human papillomavirus infection can lead to cervical cancer, penile cancer, and other cancers; human immunodeficiency virus, HIV. It is a sexually transmitted infection that is not curable but can be treated. The presence of other sexually transmitted infections increases the risk of acquiring HIV. Other routes of transmission are mother-to-child transmission, unsafe blood transfusion practices, and the sharing of sharp objects. HIV cannot be transmitted through sharing utensils, sharing toilets, hugging, or shaking hands. People living with HIV should be treated respectfully and help support their care. People living with HIV should take their drugs every day. Prevention of sexually transmitted infections. Prevention of all sexually transmitted infections is rooted in the acronym ABC. A stands for abstinence, B stands for being faithful to your partner, and C stands for condom. Also, human papillomavirus infection has a vaccine which should be taken before sexual debut. It is recommended for girls aged 9 to 14. It is readily available in many countries, including Nigeria. As with other illnesses, prevention of sexually transmitted infections is better than cure. I am sure you have benefited immensely from this video. You should share this video with your friends and relatives. Thank you for listening to this channel. You may ask questions in the comment section. Kindly like, comment, and subscribe to this channel.